myself KRUPALI LODHARI, and today our topic is classification of the BP in adults as per the JNC criteria. So JNC is Joint National Committee. The 7th report of the Joint National Committee or the prevention and detection of the evolution and the treatment and high blood pressure providing new guidelines for the hypertension to prevent and management. There are key messages. First key message: in a person older than the 50 years, systolic blood pressure of the more than 140 mmHg is much more important for the cardiovascular disease and a risk factor than the diastolic. Second, the risk factor of the CVD is beginning at the 115 and 17 mmHg, doubles with its increment of the 20 to 10 mmHg. Individuals also who are the normotensive at the 55 years of the age have a 90% lifetime risk for the developing hypertension. Third, individual with the systolic blood pressure of the 120 to the 139 mmHg or a diastolic blood pressure of the 80 to 89 mmHg should be considered as a pre-hypertensive and require health-promoting lifestyle modification to prevent the CVD. Fourth, thiazide type diuretic should be used for the drug treatment for the most patient with uncomplicated hypertension, either alone or combined with the drug from the other classes. Certain high risk conditions are complaining indication for the initial use for the other antihypertensive drug classes: angiotensin converting enzymes inhibitors, angiotensin receptors, beta blockers, and the calcium channel blockers. Fifth one was the most patient with antihypertensive require 2 or more antihypertensive medication to achieve a goal of BP greater than the 140/92 mmHg or the greater than 130 to 80 mmHg for the patient with diabetes and chronic kidney disease. Sixth, if the BP is more than 20 to 10 mmHg above the goal BP, considered should be initially therapy with 2 agents or the one of each. Usually should be a thiazide diuretics. So these are the key message for the classification for normal. Systolic is 120 and diastolic is 80. In pre-hypertensive, systolic is 120 to 139 and the diastolic is 80 to 89. In stage 1 hypertension, systolic is 140 to 50 and diastolic is 90 to 99. In stage 2 hypertension, systolic is 160 and the diastolic is 100. So this is video on the classification of the BP in adult as per JNC criteria.